Hi, my name is Cathal White. I'm a Senior Manager in the Health and Social Care team. I've had the privilege of working with the Mental Health Commission for the last couple of years. We're joined today by John Farley. John, do you want to introduce yourself and tell me a bit more about the Mental Health Commission?
Yeah, so I'm John Farley. I'm the Chief Executive of the Mental Health Commission, and we regulate the mental health services in Ireland, both inpatients, and we're due to expand out to regulate community services. We also make sure that people who are involuntarily detained because they are unwell, that's in accordance with the law and the rules. So I'm really happy to be here to speak to you.
Thanks, John. Thanks for being here. And then in terms of AI, I know at the start of the year you embarked on a new project in AI.
Yeah, so basically we are going to expand out. There's a new mental health bill going through the Oireachtas, the Irish Parliament, and really when that happens, we will be inspecting a lot more centres and a lot more services. So in looking at our current efficiency and effectiveness, we were trying to figure out how can we become more efficient and effective in what we're doing. And of course, one of the things we wanted to look at was AI capable of helping us to do this. So for example, when someone goes out in inspection, they gather all this data and information, then that's put into our systems and reports are written. And we were looking at, generally the data is similar enough, the evidence is similar enough, and really we wanted to figure out, was AI capable of helping us produce regulatory reports in a more efficient and effective way?
Perfect. So Hector, could you tell me a little bit about the work that you did at the Mental Health Commission?
Sure. Earlier this year, we worked with them, as John mentioned, where we developed an AI solution that drafted regulatory reports based on inspection information. This involved restructuring sample data, and it also involved developing an agent for report writers to interact with. The prompts we drafted were easily accessible through one click. And the solution, the good thing, given that we always kept stakeholders on the loop and we always iteratively refined it through mathematical metrics, making sure that it was improving. The solution then by design ensured reliability, accuracy, and factual grounding with the actual reports.
Perfect, thanks Hector. And then I know there's academic institutions are also interested in this, John. I believe there's a paper published.
Yeah, there is a paper published, and just to emphasize what Hector was saying, you know, we wanted to see if AI would work, and we were taken aback with the work that happened within Hector's team, that when we saw the product at the end, how well it worked. And to give you an example of that, at the start of the project, we wanted to make sure that there was objective measures, that we could publish literature on this. And so it was objective measurement tools were used to judge the AI-generated report versus our original reports. And they found the accuracy, reliability, consistency was very, very good. So we published an article, the group. So if you think about our team and the Deloitte's team working together, we put an article in for peer review, which is the application of generative AI to healthcare regulatory reporting. And it's the first of its kind. I'm part of a European body of regulators. There's a lot of interest. They're looking for us to present it, in Malta. Singapore have also asked about it because it's unique. So there's a lot of interest in the academic world, but also in the regulatory world, because we really want to make sure that we reduce red tape. We spend as much time as possible helping patients rather than writing reports. So all in all, we're really happy.
Perfect. Thanks very much, Hector and John.